Today's top stories. SBRTV's IMRT. Better for bowel symptoms, not cancer control. Dapagliflozin reduces AKI after cardiac surgery. Cefadroxil effective for gram-positive bacteremia. Evidence-based tobacco cessation strategies for low- and middle-income countries. Stat Plus. FDA approves Bristol multiple myeloma treatment, marking debut of novel drug class, constipation relief. Elobixibat outperforms Prucalopride. New evidence links atopic dermatitis to herpes zoster. Can dexamethasone drops prevent retinal disease in preemies? Caesarean deliveries catching up with spontaneous births, and Dexrazoxane may preserve LV function in cancer survivors. We start with SBRT versus IMRT. Better for bowel symptoms, not cancer control. SBRT versus IMRT. Better for bowel symptoms, not cancer control. Tobacco-Cessation in a randomized trial of men with intermediate-risk prostate cancer, stereotactic body radiotherapy, SBRT, improved bowel-related quality of life versus moderately hypofractionated intensity-modulated radiation therapy, IMRT. But it offered no advantage in terms of 3-year disease-free survival. Methodology, SBRT, allows patients with prostate cancer to have a shortened radiotherapy course, typically 5 treatments over 2 weeks. The Phase 3 NRG-GU00-5 trial was designed under the hypothesis that SBRT would also improve patient quality of life and disease-free survival relative to moderately hypofractionated IMRT. The trial enrolled patients at 136 centers in Asia, Europe, and North America from November 2017 to June 2022. A total of 698 patients, median age, 68 years, with localized intermediate-risk prostate cancer were randomly assigned in a 1:1 ratio to receive either SBRT, 36.25 J in 5 fractions, or IMRT, 70 J in 28 fractions or 60 J in 20 fractions. Primary outcomes were disease-free survival at 3 years and quality of life at 2 years, assessed by the frequency of minimal clinically important decline in the urinary irritative or obstructive and bowel domains of. Dapagliflozin reduces AKI after cardiac surgery. Patients treated with the SGLT2 inhibitor dapagliflozin prior to elective cardiac surgery had a significantly lower risk for postoperative acute kidney injury, AKI, according to results from a randomized trial. Furthermore, there was a low incidence of euglycemic diabetic ketoacidosis, which is a key concern with postoperative SGLT2 inhibitor use. To date, no therapies have been identified that reduce the incidence of AKI after cardiac surgery, the authors wrote in the study, published in JAMA. The results underscore that AKI is common after cardiac surgery, consequential and now potentially modifiable. Co-author Abraham H. Hulst, MD, PhD, of the Department of Anesthesiology at Amsterdam University Medical Center, and the Amsterdam Cardiovascular Sciences Research Institute, both in Amsterdam, Netherlands, told Medscape Medical News. The incidence of AKI after elective cardiac surgery has been estimated to range from 2% to 50%. AKI is associated with potentially serious comorbidities, including chronic kidney disease and mortality. Its causes are multifactorial and include kidney hypoperfusion, hypoxia, and inflammation, because effective preventive therapies for AKI have been Cefadroxil effective for gram-positive bacteremia. Tobacco-Cessation oral Cefadroxil demonstrated similar treatment success rates compared with intravenous, IV, and alternative oral antibiotics in patients with gram-positive bacteremia, including those with non-vertebral osteomyelitis. No severe adverse events, IS, occurred in the Cefadroxil group, and 90-day mortality, recurrent bacteremia, and readmission rates were comparable across all treatment arms. Methodology, a multi-center retrospective cohort study compared outcomes among 323 adult patients with gram-positive bacteremia treated with oral Cefadroxil, 58 patients. Median age, 54 years. 76% men, IV antibiotics, 72 patients. Median age, 53.5 years. 75% men or alternative oral antibiotics, 193 patients. Median age, 52 years. 69% men, across 4 hospitals in Los Angeles County, California. Patients with endocarditis, vertebral osteomyelitis, prosthetic joint infections, or central nervous system infections were excluded from all cohorts to ensure comparable groups. Pathogens included methicillin-susceptible Staphylococcus aureus and streptococcal species, 19% of Cefadroxil patients, 26% of IV patients, and 17% of alternative oral patients had non-vertebral osteomyelitis. Median. Evidence-based tobacco cessation strategies for low- and middle-income countries. This review provides evidence-based strategies for tobacco cessation in low- and middle-income countries, focusing on effective interventions such as nicotine replacement therapy, medication-assisted treatment, and community-based programs. The study is a peer-reviewed publication in the prestigious New England Journal of Medicine. Stat Plus, FDA approves Bristol multiple myeloma treatment, marking debut of novel drug class. The Food and Drug Administration on Thursday approved an oral treatment for advanced multiple myeloma made by Bristol Myers Squibb, marking the debut of a new class of medicine for the blood cancer, and the first drug cleared by U.S. regulators using a more sensitive measure of remission. The Bristol drug, iberdomide, will be sold under the brand name Zenbexis. It will be used in combination with two other drugs, Darzalex and Dexamethasone, to treat patients with multiple myeloma who have received at least one prior line of therapy. With the Zenbexis approval, Bristol is the first company to bring a novel class of drugs to patients with multiple myeloma, opening venues for many more potential combinations, said Christian Massacey, Bristol's chief medical officer, in an interview with Stat ahead of the approval announcement. This article is exclusive to Stat Plus subscribers. Unlock this article, plus daily coverage and analysis of the biotech sector, by subscribing to Stat Plus. Already have an account? Log in. Constipation relief. Elobixibat outperforms Prucalopride. Topline in patients with functional constipation who were refractory to first-line therapy. Elobixibat offered superior bowel movement response and symptom relief and greater improvements in quality of life than Prucalopride. Methodology: Elobixibat increases the delivery of bile acids to the colon and boosts secretion and motility, whereas Prucalopride stimulates colonic motility. However, current decision-making regarding the choice of a second-line agent for functional constipation is mostly empirical. Researchers conducted a prospective open-label study to compare the effectiveness of Elobixibat and Prucalopride across tertiary care academic centers in India between April 2025 and March 2026. Eligible patients met the Rome IV criteria for functional constipation and were refractory to first-line treatment. After a 2-week run-in period, patients received either Elobixibat 10 mg once daily or Prucalopride 2 mg once daily for 8 weeks at their treating physician's discretion. Patients maintained daily bowel diaries. The primary efficacy outcome was a sustained complete spontaneous bowel movement, CSBM, response, defined as having at least 3 CSBMs per week and an increase. New evidence links atopic dermatitis to herpes zoster. A study of more than 13 million people in the UK indicated an elevated risk for herpes zoster, HZ, in patients with atopic dermatitis, AD. The association persisted independently of comorbidities and treatments, among other factors, with the risk increasing with increasing AD severity. We have known for some time that patients with AD can have increased susceptibility to certain infections, and we also know that some of our systemic treatments can increase the risk of HZ. What is particularly notable here is the suggestion that AD itself may confer some additional risk, independent of those treatments, Peter Leo, MD, told Medscape Medical News. Importantly, adjusting for oral corticosteroids and traditional systemic immunosuppressants only modestly changed that association, added Leo, founder of the Chicago Integrative Eczema Center and clinical assistant professor of dermatology at Northwestern University in Chicago. He was asked to comment on the results and was not involved with the study. The matched cohort study, published on August 5 in JDDG, Journal der Deutschen Dermatologischen Gesellschaft, used primary care data from a UK research database of 14,081,774 observations. Can dexamethasone drops prevent retinal disease in preemies? Topline topical dexamethasone eye drops were linked to a numerical reduction in the odds of progression from prethreshold retinopathy of prematurity, ROP, to treatment requiring type 1 ROP in infants born before 30 weeks gestational age. This reduction was not statistically significant. Methodology: researchers conducted a multi-center randomized clinical trial in Sweden from September 2022 to October 2025, enrolling 100 infants, 42% girls, 5 twin pairs who were born before 30 weeks gestational age and had prethreshold ROP, defined as stage 1 or 2 ROP without plus disease in zone I or stage 2 or 3 ROP without plus disease in posterior zone II. Infants were randomly assigned to receive dexamethasone eye drops, 1 mg/ml, or placebo, preservative-free saline, with 1 drop per eye administered every other day for stage 1 or 2 ROP and daily for stage 3 ROP. Treatment was continued for up to 12 weeks. The primary outcome was progression to type 1 ROP requiring invasive treatment. Secondary outcomes were time to type 1 ROP, time to type 1 ROP among infants without regression, and ROP recurrence after laser or anti-VEGF therapy. Adverse events were monitored as safety outcome. Caesarean deliveries catching up with spontaneous births. The latest report from the National Maternity and Perinatal Audit, NMPA, showed that caesarean sections as a proportion of all births continued to climb, while spontaneous vaginal births were proportionately reduced. The State of the Nation report was based on data from 593,475 women having singleton births in NHS maternity services in England, Scotland, and Wales during 2024. It found that the proportion of women giving birth vaginally without instruments reduced further to 46.4% in 2024, down from 49.4% in 2023, and more than 25% lower than the 62.3% rate in 2015-2016. Caesarean deliveries continued to increase to 42.8% in 2024, up 3.3 percentage points from 39.5% in 2023, and up 71% since the 25% rate of 2015-2016. According to the World Health Organization, WHO, as countries increase their caesarean section rates up to 10%, maternal and neonatal mortality decrease, but rates higher than 10% are not associated with further reductions. Nevertheless, the WHO stopped recommending 10%, 15% as a target rate in 2015, saying caesareans should be performed as clinically necessary, because different population characteristics result in different needs. The NMPA figures also showed that the Dexrazoxane may preserve LV function in cancer survivors. TOPLINE dexrazoxane was associated with preserved left ventricular, LV, systolic function in childhood cancer survivors treated with doxorubicin in a new analysis. Among 895 patients, those receiving dexrazoxane showed better LV fractional shortening and reduced incidence of LV dysfunction, particularly in high-risk groups where rates approached those of moderate-risk patients. Methodology: the risk for clinical heart failure may exceed 10% by age 50 in childhood cancer survivors exposed to anthracyclines, including doxorubicin, and chest radiation. Dexrazoxane has been associated with reduced adverse LV remodeling shortly after doxorubicin treatment and preserved LV function in long-term childhood cancer survivors, though conclusions may be limited by sample size in previous studies. Researchers analyzed echocardiographic data from 895 patients enrolled in Children's Oncology Group protocols P9404, P9425, P9426, P9754, and Dana-Farber Cancer Institute Protocol 9501, who received doxorubicin treatment with a median dose of 360 mg/m2. Participants were followed for a mean of 5.9 years, with 230 patients having a greater or equal to 10-year follow-up. Most protocols featured upfront one random as. That's all for this news briefing. Thanks for listening. Also, don't forget to hit the subscribe button.